Okay, welcome back to the Quick Start Guide to Online Therapy. We're going to talk about, I'm going to talk about treatment. It's just me now. Doug is ducked out for this part. So we're going to talk a little bit about treatment and treatment considerations and how to get going with best practice with online therapy. So there's many different ways we can use the internet and technology in treatment. I'm going to go quickly through most of these, but spend a little bit more time on video and on telephone, because I think that's what most of us are going to be using when we go online and help people through COVID-19. There's also email therapy, which most people don't have access to a platform for that. I'll talk a little bit about how you can do that in the absence of a platform. Sometimes people work for different companies that do that. There's like Beacon Health and different places that use ICBT or email therapy, which is actually quite effective. But for the purposes of getting up to speed with a telehealth, most of us are going to be doing one-on-one treatment with a particular person in lieu of their in-office visit if we all have to be isolated or they have to be isolated and or quarantined. So let's get started. So video chat, the first thing I'll talk about is it's actually quite effective. I haven't really updated the studies here. If you've been to one of my past talks and have those slides, there's just so many of them. They do tend to be small samples and different kinds of populations. But what we find time and time again, and telehealth has actually been around for quite some time. You know, the video platforms that we're using now to do this quite quickly and securely with patients, you know, through our own practices, are relatively new, but telehealth and video chat has been around in hospitals and healthcare centers for quite some time. So there is quite a bit of research on it. There tends to be, so the efficacy is as good in most of these studies as face-to-face. Where we see some really strong support for his patients really like it. Once they start doing it, it's so convenient and handy, and especially for people in rural and remote communities where they might not have access to specialized care, it can be a godsend. So high client satisfaction, high therapeutic efficacy, strong therapeutic alliance. People who do video therapy, and this is true for actually all these different kinds of online therapy approaches, is that the therapeutic alliance is really strong, whether it's email therapy, telephone therapy, video therapy. So we find that time and time again that you don't have to sacrifice that when you offer online therapy to your patients. But you know, here we're talking about video chat, and it's very effective. The one limitation with a lot of the studies is they do tend to be a little bit on the small side, but you know, good effect sizes. So you can feel good about using it. So, and there's lots of books to read about it. And, you know, if you want to do a deeper dive into what I talk about here and sort of this quick start guide, you can find a lot more about how to handle. Sometimes people are so comfortable at home, they over-disclose a little bit more than they normally would in office. There's a few little things like that you want to be aware of. So it is a good idea to read more, get on top of best practice in this area. But for most of us, it's quite a comfortable transition into online therapy. So, but there are some considerations. So let's go through some of the specific things you need to be aware of when you practice online therapy. So the first one's a very practical one: lighting. You need to have good lighting so that your client can see you, or I'll recommend that they have good lighting so I can see their facial expression. Bandwidth is becoming less and less of a problem. A lot of these programs will use, they actually like adjust the resolution of the picture to match your bandwidth or the client's bandwidth, how fast your internet connection is. So it's with some good software. For example, Zoom explains how they do this on their website. You can you can get fairly good quality video even if your internet's not perfect. That being said, if somebody's watching Netflix on the network, that can slow things down, or like you're in an office and everybody's using the Wi-Fi or the internet for video conferencing, that can slow things down. So make sure if you're going to be working from home, if you can get through to your cable company. A lot of them are saying now that they are going to waive caps on data, but they might not increase the speed of your internet. So you might want to, if you're going to do more online therapy, bump that up a bit at your home or office so that you can handle all the extra traffic. The other thing to watch is your background, so make sure that there's nothing inappropriate behind you. It's probably easy if it's in your office, but then you want to make sure like there's no files that somebody could see or anything. Like if you have a different computer on in the background, that nothing could be seen. Like if it's screenshotted, like even if you think like somebody can't read it, they might be able to screenshot without your knowing and blow it up, so that they could see what was on that screen or on that piece of paper, or infer a lot more than you think that they could. But if you're doing it at home, you want to make sure that you you pick up a place where you're not going to see too much. So if I'm at my home office doing an online therapy session, I actually have the computer, I use my iPad, and I'm up against a white wall. So I have a chair back at a white wall, so they can't really see anything about my home, anything about my surroundings. It's very neutral, and they pretty much only see my face. The clothing that you wear, we don't think about this in face-to-face meetings, but if you're wearing too busy a pattern or stripes, that can look funny on the camera as well. Solid colors are just a better thing to wear, so that's not a distraction. Somebody gave me the tip that if you're drinking water and you're on camera, you should actually have an opaque glass, because it can look quite funny if you have a clear glass and you're taking a sip of water and they see your teeth, and it's just, it's not good. So get an opaque water glass, or use a solid coffee mug or something. Also good to use a mic, so not to rely on the mic in your device, like plug something in, or even better, use a headset so there's no feedback. I often recommend to my clients that they get a headset as well. It sounds better for me. I want to be able to hear them properly. So that's part of what I'll tell them to have in place when we're doing a video chat, instead of just being on the speakers on the computer. You also have to make sure that the client is in an appropriate setting as well. So you want to make sure that nobody's going to walk in, and let them know that if there's anybody off camera, you want to know that too. So anybody who is, like if you're seeing a couple or a family session, you want to make sure that you know who is in the room when you're doing therapy. And that they have some expectation of privacy. There's all kinds of us who have done online therapy. We all have stories about different people that walked in. And then we talked a lot. I'm not going to belabor the security of the platform. We talked a lot about that in the previous section. So those are all things to keep in mind when you're doing video sessions with your client. Things that you don't have to think about in an office. Some of the other things that I also like is to have one computer that I have the video conference on, and then I have another computer or a notepad to take notes. I find that's kind of useful too. If you forget, like if you're just used to working with one computer in a session and then you use it for your video chat, it can be hard. There are some platforms though, I don't, because I've been using Zoom lately, but there are some platforms that have that integrated, where you can take notes while you have your client in another window. So depending on the software you have, you might not need a second device, but I do. So that's a good thing to sort of keep in mind. So, and after that, the other thing to keep in mind is the over-disclosure effect. Sometimes people, when they're comfortable in their home, tell you more than they would. They pace it out a little bit more slowly when you're in your office. So you sometimes want to slow your client down. So that's your quick start guide to video chat. I'm not going to talk about specifics about therapy because we all have different therapeutic orientations, but you can certainly read more about how to apply what you do to the online setting to, definitely look up different research articles and read more about it. But most of us actually, it's a fairly easy transition to working online. I know there's also, I'm not going to get too much an assessment for this course because I think most of us are not going to be we're going to be taking existing clients and moving them to online. And some of us might get new clients as well, but we might alter our assessment as well. So the other things to keep in mind with video is you might not see everything if you're assessing a new client. You're not seeing their hygiene as quickly, although some people recommend that you get them to hold their hands up to the camera so you can see their fingernails. Well, you would never ask that. You would look for that sort of thing a little bit more surreptitiously, but ask them to come closer to the camera and show you different things so you could see, infer a little bit about their hygiene or other problems if they're depressed. You can certainly get a sense of how comfortable they feel on camera. That might be a little bit odd for them at first, so that might interfere a little bit with how they are presenting. But for the most part, be mindful of those things and talk to colleagues. I think when you start doing more video calls, it's really helpful. I was really lucky in that I have quite a few colleagues who are early adopters like me, and we've been doing this for a while, and we've always chatted with each other about the different kinds of things that happened. And so it's good to have that support and consultation group when you're starting a new modality or new approach to therapy. So even though you're using your typical kind of theoretical orientation and your typical interventions, still very helpful to connect with your colleagues about all the little things that pop up as you do online therapy. And there's lots of great things to read as well. So that's should be enough to get you started with your first assessment and first session anyway. So that you're thinking about a few of these things, but do keep reading. This never ends in learning and consulting with your colleagues. So therapy over the phone. So most of us have done this. It's often used for crisis calls. I like to offer it to people who have not shown for their appointment because they've forgotten. And when I catch them on the phone, I'll ask them, do you want to do a phone session? I hate charging for a missed appointment. We could at least do a telephone session if you're in a good place. And, 9 times out of 10 people say yes. And then it feels a lot better than charging them the late cancel fee. Sometimes I'll do quick check-ins between emails or appointments, depending on some of the homework that I've had them do. I charge for that, of course, for a longer phone, like a 15-minute call. But you also want to check the security of your phone connection. If you're using, say, for example, a voice over IP phone or an internet phone, you want to do the same due diligence that you would do with your video chat service, making sure that it is secure and encrypted. But check to make sure that even people can't listen in, that you have a private place to work. The other thing to keep in mind when you're doing therapy over the phone is that people typically, because you don't have those nonverbals, right? They can't see you nodding your head in agreement and that you're listening to them. So you have to do that verbally with saying mm-hmm and because if you're quiet for too long, the clients will get sometimes nervous and go, are you still there? And so you want to be vocalizing in some way to let them know that you're engaged and following and paying attention to what they're saying. So be very conscious of that. The other thing that can really help with how you sound, to the pitch of your voice, the quality, the tone, is to stand while you talk. It invigorates you and actually to smile while you talk too. It's kind of funny, but we can hear it in someone's voice if they're smiling. They have a different kind of sound, and it makes a huge difference. And to be wary of pauses in the conversation. In a face-to-face session, we might feel more comfortable. pausing, leaving a long pause, letting the other person take their time responding, whereas it feels like we're disconnected with therapy over the phone. So depending on the patient, the kind of rapport that you have with them, you might keep your pauses shorter on the phone than you would in a face-to-face session. And then like video therapy, outcomes are good. The research shows telephone therapy can be effective for a variety of concerns, that people really like it. Often I find when, because I offer it to so many people when they've forgotten an appointment, I often get them kind of hooked to it. Once they do it once, they say, "Oh no, I don't want a phone session." But if they're really busy, they're much more likely to have future phone sessions. Actually, I kind of enjoy them too. I get to move around a little bit more. If you're sitting in a chair a long time, I like phone therapy. I think it works well for a lot of people. I do a lot of CBT though, so maybe that's me. So next, I've got virtual reality, and now most of us aren't going to be doing this through COVID-19 distance therapy, but I thought I'd just mention it. I had the slide, and I usually talk about it when I talk about tech. Since I last did this talk, I got myself my own virtual reality headset. Maybe I'll do a talk about that. I am absolutely loving it, especially for my fear of flying people. It is so good, and heights too. So I picked a program. It's a startup company that, I'm not too worried if they go, but I think they're doing well, so it's good. But what I find with it is you get to really coach a person through their fears. And even though the images now in most VR headsets for therapy are pretty cartoony, it tricks your brain. It's quite funny how well it works in putting you in that environment. And I find, especially for my patients who haven't been on a plane for a long time and really forget what it feels like, it's great for them. It's been a really great way to practice, and their anxiety is going down and they're starting to feel more confident. Sometimes what I do is I will get them to do it without the sound. You can add earplugs so they can just do the visual, or I could have them do it. Well, you have to have this headset on. Sometimes I'll use YouTube actually if I do sound only, no visuals, and I'll have the sound of a plane from a YouTube video playing. With the VR headset, I do it with or without the sound, so that they can do visuals only. And then when you put the headset in, you in the program I have, you actually hear them talk. You hear the other passengers on the virtual plane talk about plane crashes. So it's pretty good exposure for people. It's used a lot in PTSD as well as for phobias. It's used for cognitive rehab, for people, helping them to play different games or make different movements. One problem with it can be cyber sickness for some people. Some people, just like if you're sensitive to car sickness, you might be more prone to cyber sickness. And it's just because things don't always match up with what your brain thinks how they should be moving. So it can make you a little bit nauseous. Cost is also an issue. They are not cheap. But I'm having so much fun with it. It's totally worth it. I'm really getting a kick out of it now. And what I find too is really fun is my patients are super excited to try it in a way that, isn't typical for exposure. So it's still pretty novel for most people, but kind of fun. And then I mentioned failed startups. There have been a lot of failed startups. When I was researching for my latest headset, I found a lot of companies, that were written about, and then when I went to go to their website, they were gone. So keep that in mind because it is a little bit of an investment. Now, during coronavirus, I have kind of packed it away a little bit so that I'm not sharing it. There's a lot of things, though, that you can do to keep it clean. I luckily have a lot of alcohol swabs before they all sold out. Now they're hard to find, but I'm good for I think a year. Even if I used it every day, I bought a bulk pack from a medical supply store, so I'm good for a while. And then, but the other thing I have, so I use that to clean away So when you're talking about, like, this is what I've learned from hospitals, when you do your WMIS training, first you clean up any sort of visible dirt and then you disinfect. Well, I use the alcohol wipes and that kind of cleans and disinfects at the same time. If I'm really concerned though, I actually got a UV sterilizer for my office. And I confirmed with the VR company that it was safe to use with the headset. And so the UV light kills anything extra as well. So I use that for both. So alcohol wipes they also recommend. The other thing you can get to protect your VR headset and keep it from, although I'm being extra cautious and just not using it right now, but you can also, you can get these on Amazon. You can get masks that you put over, they hook over your ears and they cover your eyes so that your face doesn't touch the mask part. So there's a barrier. They're just like little paper VR hygiene masks that you can use. And if you're really worried, you could even put a hairnet on top. So, because the goggles strap over your eyes and then strap over your head as well. So if you're worried about that, you could, if a patient's really worried about it, I tend to clean it off with the alcohol wipes, but I do have some like surgical hair nets for some of my patients with OCD. There's some good OCD germ exposure scenarios on my VR set. So I'm just kind of prepared for them with these kind of surgical masks, but I don't make everybody wear them. So that's more for the person if they're very concerned about germs, then I have that for them. But you do have to make sure that you can clean it. So that would be the one thing that's sort of relevant for anyone else who's using any kind of equipment like that with their patients. But if we're working remotely with people, I am not going to get to do VR for a while. So that is disappointing because it's lots of fun. So there's computerized CBT. So some organizations, some employers have this available for their patients, or for their employees. What we know is, like, if it's self-guided CBT, what tends to happen is if people finish it, you actually get not terrible outcomes, but most people drop out. There's a very large dropout rate. So even in some of the, and then you have to be careful when you read the studies about them, because they'll talk about, the outcomes for people who actually finish the program, which are pretty good. The effect sizes are pretty good, but the dropouts are so high that, they don't include that in the effect size. And if there's a comparison group, it's not as good. So it's really clear. It's better than nothing. It's self-help. But if you don't have a therapist helping you, it's just not as effective. So then we have ICBT, which is kind of like computerized, like online courses combined with a therapist. So you're not doing the one-on-one therapy you could. Now people are using more blended therapy where you use a combination of this, and I would say that's mostly what I do. So I'll have a therapy session with somebody, and then they have homework, and maybe instead of coming weekly, they come every 2 or 3 weeks in the office, but we keep in touch. And they send me their homework over encrypted email, and then I write them responses. I give them feedback and support through encrypted email for their work, and then I charge them, probably for a 15-minute session, basically, for the time that it takes. One of the nice things about ICBT is the outcomes are really good. Heather Hedges-Stavropoulos at the University of Saskatchewan here in Canada, she has done so much research on this and started the online, the online therapy user, that's what it is, online therapy user group through the University of Regina. Sorry, Heather, I blanked on the name of the clinic that you started. Just doing fabulous research, really demonstrating that online therapy is as effective as face-to-face therapy for a variety of concerns. Patients really like it. It's still early days, but doing really well in the province of Saskatchewan. There are some private companies that are doing this now that you can sign up as a therapist and work for them. But I do it in my own practice using encrypted email. So I have an encrypted email account as well as the client. and we email back and forth and review their homework. I've done different things for content. I have written a lot of content that I send back and forth to them myself, because I do a lot of writing and I feel comfortable doing that. There's also, though, I've used a lot of the materials from the Center for Clinical Interventions, and then they'll email me a PDF that they filled out from their end. So usually people are a little bit more, because they're not fillable PDFs. If anybody's used the great workbooks at Center for Clinical Interventions, a lot of us know about those. They're PDFs of depression, anxiety, perfectionism, health anxiety. Like they have so many great workbooks, really well done. So what people will do is send me a PDF that they put together from their end of the completed workbook. So some of my more techie patients are comfortable doing something like that. If it was a fillable PDF, it would be a bit easier, but there's certainly different things that you can do. Sometimes I've even assigned a book, and then they'll a physical book from their end, and then they'll send me their responses that they or their thoughts about the book that they've read. So there's different ways that you can do that, but it's supplementing. It can be either blended care, where you supplement your face-to-face sessions, and then it helps stretch out their dollars. Most of my patients have gotten reimbursed from their insurer, but I do tell them to check that out. But a 15-minute session is cost effective. It's not really possible for me to do a 15-minute face-to-face session because it'd be quite disruptive. Excuse me, throughout the day, but with an email session, very quick for me to do, and I just bill them for 15 minutes. Okay, and then, the answers can be either supportive or more detailed. And then it's also very well researched. I mentioned Heather Hedges-Stavropoulos at the University of University of Regina. I've been going straight through these talks, so I can feel myself getting a little punchy here. I'm sure it's even harder to listen to me than it is to be the one talking here. But also out of Sweden, the Internet Psychiatry Institute has done over 100 studies in less than 15 years. So email therapy, or ICBT, really lends itself well to research because everything is captured online. All the assessments, all of the interactions between therapist and patient. And so really this is an area of research. And you can see it's been going for 15 years. In Sweden, Australia, they're really ahead of the curve in this. Lots of research on this being an effective approach, even though a lot of therapists aren't familiar with it. So I think it's going to be growing. Once patients try it and get to know it, they actually really quite like it, and they feel as connected to their therapist. It's kind of like having a pen pal. And if any of you have had a pen pal, you can have quite a nice relationship with a person via pen pal. So that people do tend to feel quite connected to their therapist and feel supported. And I've had people who have printed off some of the emails that I've sent them, and they keep it on them as a reminder of what they're supposed to be working on, or it inspires them or encourages them. So that's a really nice feature. And then they get to keep the therapy after. They get to see and remember, and in a way that, you can have a great insight in a face-to-face session, and then it's, sometimes you forget, what was that? That was such a good session, and you don't remember what it was that your therapist said to you. So I really like email therapy. So for some of you, that might be a handy thing to have in your therapeutic toolkit. Again, lots of books on how to do this. Online Therapy Institute in particular, Kate Anthony's program, she does quite a bit of this and talks about it. So lots of good resources on how to do email therapy, or ICBT. And then when you do email patients, you want to make sure you're using encrypted email. There's a number of good programs out there that you can do that with. One is a Canadian one, Hushmail, here in Vancouver. They're a really great service, but there's others as well. But I like Hushmail. And you want to keep reminding your clients about safe communications, not leaving their email open. So you want to think of, privacy reminders are kind of ongoing. There's a little bit more explaining with this kind of therapy than there are with, the video chat or telephone chat. It's a little new for people. So you're going to have to explain how it works, and have some detailed starting points and to get them going. And you want to keep your emails to 300 to 600 words. That's quite a lot, but you don't put too much. You kind of just want to hone in on a point or two. You don't even have to address everything in their email. Think about a theme or for something to work on. I've certainly taught workshops on therapeutic writing and how you do these and do more practices. So it's beyond the scope of this talk today, but there's more that you can learn about how to write these therapeutic emails. A lot of people who do this were also narrative therapists. So, for those of us, and actually I like narrative therapy. So maybe that's why I like it a lot too. And I like writing. So this kind of therapy appeals to me. Lots of reflecting kinds of statements, focusing on people's strengths. Not a lot of confrontation in this kind of therapy. You keep it a little bit more upbeat because there's some room for misunderstandings, more so than other kinds of therapy. So you keep it positive, and then a lot of the email involves suggestions and homework to do in between sessions. Okay, so that's the whirlwind of your introduction. Of course, there's so much more to learn, but you don't have to do it all at once. But hopefully at the end of this, you feel a little bit more comfortable, a little bit more about what's out there and what can help you. And I really like this quote from Kevin Kelly, who is a tech writer. I like a lot of his stuff. And so you can read more about his books. One is The Inevitable, which is all about what's happening with tech and going forward. So if you want to nerd out on that stuff like me, he's a great author. But I love this quote because I think, because the cycle of obsolescence is accelerating, the average lifespan of a phone app is a mere 30 days before it's updated and often changed around. You won't have time to master anything before it is displaced, so you will remain in the newbie mode forever. So if you feel like a newbie and that this is all overwhelming and new, that's how you will always feel with this stuff. There is always more to learn, and you need to talk to other people about it and connect with others. And there's a really nice group of us who do a lot of online therapy and love talking about it. So we're probably not that hard to find once you locate us. So it's just such a great way to bring therapy to people and meet them where they are. And so please don't feel intimidated. You can catch up on this. I know I kind of went through this very quickly. Normally I would take more time, but I've had so many requests in the last week or so, but especially over the past couple of days. So a lot of you are really itching to get going. So I hope this helped. Do let me know if you have any questions. You can email me at Christine@therapythinktank.com. That was a project, therapythinktank.com. The website's not quite ready, but I'll get the email up. That was a project I was going to start this summer, just writing more about online therapy and best practices, and kind of like a blog, and I don't know what it'll evolve into. But check that out, and I think I'll be having it up sooner rather than later. But in the meantime, you can email me at this email address if you have any questions or requests for future videos that we can do. And maybe I'll even show up on camera. I threw this together so quickly. I'm like, I cannot go on camera. I'm just going to screencast this one. So in the future, maybe you'll see my smiling face too. And anyway, good luck with everything. Everybody stay healthy and well, and keep your practices going, and let's all connect with each other and support each other through this. You don't have to do this stuff alone. So take care, everyone. Have a great day. Bye.